Hello, I wanted to introduce this playlist with a video just talking about some very general aspects of spinal cord injuries. Now, spinal cord injuries are devastating injuries, made even worse by the fact that so many of them affect young people and particularly young men. These injuries are so devastating for a number of reasons. They affect multiple systems of the nervous system, and that has knock-on effects on multiple other body systems. And not only do patients have mobility issues, but also sensory and autonomic problems. So what we're going to do in this very short video is look at some of the causes of spinal cord injury, think about how we can classify them, and then consider their effects on the various systems, and finally a few general comments about the prognosis of spinal cord injuries. Spinal cord injuries have many different causes, not just the classic traumatic causes which you might have read about in the newspapers. I like to think about the causes of disease using a mnemonic called A vitamin C. And this mnemonic helps us to organise our thoughts when it comes to the etiology of disease. The A and the C in this mnemonic stand for acquired and congenital. And it usually makes sense to deal with the congenital causes first. Probably the most common congenital cause for spinal cord injury is neural tube defects, spina bifida. And in these, frequently the spinal cord either fails to develop normally or the surrounding soft tissues or bone is abnormal as well. And so this is probably the most common cause of spinal cord injury as a congenital condition. And thankfully, these are relatively rare nowadays due to folate supplementation during pregnancy. The majority of spinal cord injuries are acquired. And these acquired causes fit into these various categories below. Vascular lesions are in fact a remarkably common cause of spinal cord injury. And the kinds of things I'm thinking about are occlusion of blood vessels supplying the spinal cord, so for example the anterior spinal artery, or even some of the feeder vessels coming in off of the aorta. And the classic vessel to be involved in this is the artery of Adamkiewicz, which can be involved in aortic aneurysm surgery. So it is a recognised complication of aortic aneurysm repair that the spinal cord can become compromised. And so certain measures are taken to try to prevent that during surgery. Infections are another important cause of spinal cord injuries. So thinking about, for example, complications of meningitis, abscesses, also certain viral infections can damage the spinal cord. Trauma, of course, a very important cause. We know that, for example, activities like horse riding, rock climbing, motorsports make our spinal cords very susceptible to damage. And the particular region that is most susceptible is the cervical spinal cord, due to the fact that the head is relatively heavy and the cervical cord has the most mobility. Autoimmune conditions are an important group of conditions that can affect the cord. And probably the best example of this is one of the complications of multiple sclerosis called transverse myelitis. And this is a condition where you can have a relatively large multiple sclerosis plaque, which can involve some or all of the cross-sectional area of the cord. Metabolic conditions, I'm thinking maybe vitamin deficiencies. For example, we know that deficiency of vitamin B12 can lead to conditions like subacute combined degeneration of the cord. So vitamin deficiencies are important. Idiopathic causes, that is causes that we have no knowledge of what has caused them. Of course, these exist for all diseases, and spinal cord injuries are no exception. But iatrogenic causes are an important group. Iatrogenic means that these are spinal cord injuries which have been caused as a result of complication of treatment. So the example of complications following aneurysm repair is one. Also complications following, for example, herniated intervertebral disc repair could be another. And finally, neoplasms, tumours. These are relatively uncommon around the spinal cord, but they do occur, and they can either be extrinsic, so outside of the cord, compressing it, or intrinsic within the cord, growing within the cord parenchyma, damaging axons and neurons in that way. So those are the causes of spinal cord injury. The way that we can classify these injuries is actually quite a complex area, which I don't want to talk about in any great detail. There are many, many different ways to classify spinal cord injuries. However, let's think about this in the simplest possible terms. A simple way to think about them is to make a distinguishment between sharp injuries versus blunt injuries. Okay, so you can imagine a group of cord injuries caused by knives, for example, sharp injuries cutting transversely across the cord, versus blunt injuries where these are, blunt force trauma, for example, or as a consequence of dislocation of vertebrae. Another way that we can think about cord injuries is whether they are complete or incomplete. So has there been complete transection of the cord, or has only a part of the cross-sectional area of the cord been involved? And in real life, most spinal cord injuries are due to blunt trauma, and most of them are incomplete. All right? And the fact that most of these lesions are incomplete actually gives us a certain amount of optimism when it comes to thinking about the prognosis. Now, as we said, the effects of these lesions, these injuries, are devastating to the patients. Of course, we have the classic effects of paralysis and sensory loss, which most people think about when they think about spinal cord injury. And of course, if this is a complete lesion, then there is paralysis below the level of the lesion, as well as complete sensory loss below the level of the lesion. However, we must not forget that there are axons running within the spinal cord which are part of the autonomic nervous system. And if we transect the spinal cord, we can also affect the function of organs which are controlled by the autonomic system. And this is particularly important with regard to the pelvic organs. And if you speak to patients with spinal cord injuries, often they will say that the most difficult of their symptoms to deal with is not the paralysis and sensory loss, it is the effect on bladder, bowel, and sexual function. We must not forget also that in very high spinal cord injuries, the phrenic nerve can become involved, and these patients can have trouble breathing and may need to be ventilated. Finally, another important effect reminds us that spinal cord injury is in fact a multi-system disorder. It's not just a nervous system disorder, it is a multi-system disorder. And these patients have susceptibility to many chronic and acute conditions. And two that I want to highlight is due to their immobility, they have a susceptibility to bed sores. And secondly, they are susceptible to a number of different infections, particularly urinary tract infections, as well as infections of the respiratory system. And sadly, it is complications of infections which result in the deaths of many patients with spinal cord injury. Finally, let's think about the prognosis of spinal cord injuries. We know that if patients with spinal cord injury are looked after well, if they manage to survive the initial acute period after their injury, they can actually enjoy a relatively high quality of life, and they can do very well indeed. We know that there is frequently spontaneous improvement of function, and this reminds us that the nervous system, even in adults, has this remarkable capacity to rewire itself, and we call this neuroplasticity. So in patients who still have some neural tissue bridging their lesions, they can demonstrate remarkable spontaneous improvement due to the neuroplasticity of the brain and spinal cord. However, sadly, it can be the case that patients can develop secondary damage to their spinal cord. And this is thought to involve inflammatory cascades, as well as the continuation of a demyelinating effect during the months and years after their initial injury. And in fact, a lot of new therapies that are being brought in are looking at minimizing this secondary damage and demyelination. Amongst other of the novel therapies that are being looked at include those which help to promote the survival of neurons. So if we could keep alive some of the neurons that might otherwise have died after the acute injury, that will help with the recovery. Therapies to improve plasticity, and also, more optimistically, therapies to try to stimulate the regeneration of severed axons, which can then travel up or down the spinal cord to cross over the lesion. So that's all I want to say really with regards to this very broad and general introduction to spinal cord injury. Thank you for listening.